Successfully adopting electronic health record systems.
Electronic health record systems are changing the landscape of the healthcare industry.
They have had an effect on providers, patients, insurance companies, and researchers, to name a few. They have greatly impacted U.S. policy and legislation. Some of the benefits include reducing unnecessary tests and procedures, lowering costs, and improving patient safety. EHR comes with its own set of challenges, including costly adoption and upkeep and potential negative morale impact on staff. The successful adoption of an EHR system should take into account a number of factors, including system capabilities, adherence to MACRA and meaningful use policies, dealing with the legacy systems, and a number of adoption barriers. This presentation will end with recommendations for the adoption of an EHR system. EHR's impressive capabilities are one reason they have been so widely implemented. They are used to record patient demographics, order and send prescriptions, and other lab work. They can share patient records with both patients and other providers as well. They also include technological safety features such as health information security measures. In addition to technical measures, they also include clinical safety, such as potential negative drug event warning systems, clinical support, and standard care guideline reminders. The Medicare Access and Chip Reauthorization Act, or MACRA, was passed in 2015 in an effort to monitor and increase the quality and effectiveness of care. Two relevant sections of MACRA include the Merit-Based Incentive Payment Systems, MIPS, or the Alternative and Advanced Alternative Payment Models. MIPS contains performance measures for quality of care, resource use or costs, clinical practice improvement, such as increased care access or increased care coordination, and meaningful use or certified EHR technology, including interoperability. Alternative payment models include accountable care organizations, patient-centered medical homes, and bundled payment models. Advanced status requires certified EHR technology. Meaningful use was rolled out in 3 stages. The first and most basic encouraged organizations to improve their daily work with modern technology. This included the adoption of certified EHR technology, recording clinical data such as patient history, and allowing patient access to that information. Stage 2 pushed for more complex and effective use of EHR. This new stage required care coordination, exchanging of the patient information required in Step 1, clinical support decision to increase patient safety, and EHR models allowing for patient engagement. Stage 3 added new requirements of improved technological security of patient information, computerized medication and test ordering, increased ability to exchange patient information, and case reporting for public health benefits. Legacy EHR systems are outdated systems that struggle to keep up with the newest advancements in health information technology. They can cause major problems to an organization, however, the process to replace them should be carefully considered. Legacy systems can increase system failures and crashes, leading to patient risks, especially in emergency situations. They can increase personal health information security threats. They can also present interoperability challenges, as many of them were created pre-standardization, where models were not designed to interface, and often actually intentionally did not interface properly due to producer competition. One approach organizations sometimes take is fixing legacy systems with patches. This must be done with caution, as continuous patches can lead to increased system failures and can waste money putting off the inevitable need to update the system altogether. Due to the high cost of adopting a new EHR system, deciding whether or not a system needs to be updated must be well considered, and organizations' needs should be thoroughly investigated. Updating a system takes expensive, high-quality tech support, as well as an emphasis on staff education to alleviate negative perceptions and morale issues. There are a number of barriers for an organization to overcome while going through the process of adopting a new EHR system. Investigating, choosing the correct system, and training staff can be very time-consuming. The cost of a new system alone can be overwhelming, but there are added expenses like increased tech support and costly labor spent in training staff to use a new system. The reliability of the system can also be a cause for pause, since crashes can be incredibly problematic and stressful to staff. Another common concern for staff is patient acceptance. Some staff will be resistant to the added responsibility of educating patients about the effectiveness of EHR systems in improving care. Workflow disruption is another barrier to overcome. Instituting an EHR system means learning new skills, such as ways of interacting with patients while also utilizing these systems. This new type of interaction is just one more training opportunity that will have to be addressed.
Safety is also a concern for EHR systems. Safety can be broken down into 3 categories: administrative, such as system security evaluation; physical, such as workstation security; and technological, such as data encryption. The last, and arguably most important barrier to adoption, is the interoperability of any potential system. Factors that must be considered are: does the system use standardized terminology? Is it user-friendly? Is there sufficient education materials and support to accompany it? And are there appropriate security measures to keep patients' information safe? 3 key steps are choosing the correct system, fully preparing for the transition and transitioning, and following up after the transition. Adopting the correct system means fully investigating the needs of the organization before making a choice. Preparation for the transition must consider what support will be necessary and continuing that support throughout the transition. Lastly, continue to follow up with the staff and the efficiency of the system so that adjustments can be made appropriately. To conclude, EHR systems come with high potential for patient safety, security, and involvement, as well as research possibilities, especially for the benefit of public health. It certainly comes with its fair share of concerns, such as the cost and stress it can cause an organization. Regardless, EHR systems are essential in today's medical field, and successfully adopting the right system can keep an organization running effectively, efficiently, and maintain compliant with policy and legislation.